It has been quite some time that we are meeting in this platform. It is indeed a very great pleasure to meet all of you all here once again. I hope all of you all are keeping good in the second wave of this pandemic. So, to create an awareness among all of us with respect to the second wave, where there are so much of rumors, everything going about, and precautions to be taken by us, we have before us none other than Dr.V. Ramasubramanian, who is the head of infectious diseases Apollo Hospital. His motto, his slogan is, "I am a resistance fighter." So, on to Mr. J. Ravindran to welcome our speaker for the day.
Good evening, everybody. Before I start the meeting, we condole the sudden demise of actor Vivek, Mr. Ashish Yechuri, who's son of Mr. Sitaram Yechuri. Mr. Sitaram Yechuri has participated as a guest in 2 meetings, seminars, and Mr. Shahul Amit was a very best friend. Today's topic is the impact of COVID second wave. When I forwarded the WhatsApp message of the invite to everybody yesterday, to my friends, the immediate response which I got from them is timely topic and need of the hour. And the right person to be speaking, who is speaking about this topic, is none other than Dr. V. Ramasubramanian, who's head of infectious disease, Apollo Hospitals. Doctor, I am really thankful to you. In your busy schedule, you have accepted our invite and graciously you have come here. Now, I would request Dr. V. Ramasubramanian to address the August gathering.
Thank you very much, Mr. Ravindran, for this invitation, and I'm happy to be addressing all of you this evening. I thought I'll speak for maybe about 10-12 minutes or so, and then can we open out for questions, or would you like it any different?
Doctor, anyway, Doctor, I leave it to you, Doctor, because there are so many doubts which so many people have. If your speech covers everything, Doctor, there might not be any questions, because I know your speech will cover the entire topic.
Thank you very much. Anyway, so I will give a brief overview and then we can take questions, because even if I cover all the aspects, there'll still be a lot of individual questions which need to be answered. So I'll leave enough time for questions. Now we are in the midst of the second wave of the pandemic in India. Several countries in the world are now going through their third wave, and some of them during the fourth wave also. But surprisingly, in India, the first wave was a huge wave which started probably around April, May of last year and lasted till September, October of last year, and then it slowly went down, only to resurface in end February, and we are now going through the peak of the second wave in especially Maharashtra, Tamil Nadu, and Gujarat. Now, if you ask me, is this unexpected? Is this something which we didn't know about? It is wrong. It was George Santayana who said that a person who forgets history is condemned to repeat it. And we have seen the same history unfold over a century ago in 1918, when the Spanish flu hit the world. The first wave killed almost 10 million people. And when the first wave came down, people started rejoicing. The initial lockdown, which the first wave mandated, was all lost. They came out, they celebrated in the streets, they had started partying. And in a matter of 2 to 3 months, the second wave hit, which killed more number of people than the first wave. So that by the end of these two waves in 1918, 1919, just after the World War I, over 50 million people were dead. This is much more than the number of people who died in both World War I and World War II put together. We are going through a similar phase. The SARS coronavirus, which is what we call an RNA virus, is similar to the flu virus. We have had the first wave, and we are now in the middle of the second wave, and I believe there will be a third wave, because unless we reach the magic number of herd immunity in the region of about 80% or so, we are likely to have another wave, and it may not be as severe as this one, but still we are going to go through it. So is this SARS coronavirus, which is caused by an RNA virus, which is similar to the flu virus, can we take this as a type of flu? No, because the flu, when we compare the flu and the SARS coronavirus 2, there are certain differences. When we look at the R0 is the terminology used in medicine, where we refer to the number of people infected by one person who has the disease. So if you look at flu, the R0 is 1 to 2, whereas one person of flu can infect a maximum of 2 people. Whereas for SARS coronavirus, the R naught is anywhere from 1 to 3 or sometimes even higher. That is, one single person can infect more number of people, which means it is more infectious than the flu. Second, if you look at the number of people who become unwell and who may need hospitalization, the flu, you find that it is less than 1%. Whereas with SARS coronavirus 2 or COVID-19, it is as high as 20%. If you look at the number of people who die or the case fatality rate, it is less than 1% for flu. It is somewhere in the region of 2 to 3% for SARS coronavirus 2, especially as the people get older and also have other comorbidities like diabetes, hypertension, and heart disease. So there is some similarity between the flu and the coronavirus COVID, but it is probably a far more devastating disease with respect to the infectivity and with respect to the affliction and the mortality. So why is it that we are having the second wave right now? Is it because we didn't know how to control it? No. We realized even the first wave that three important aspects of human behavior modification is needed in controlling the virus, what we call as non-pharmacological ways. This will include one, wearing a mask. It is very clearly shown that wearing a mask is probably one of the best ways to prevent transmission of the infection. And it is more beneficial when somebody who has the infection wear a mask than 20 people around him to prevent the disease. To give you an example, if there are two people, you have an infected person and a normal person. If neither of them wear a mask, the risk of transmission is about 70%. If the infected person wears a mask and the healthy person who's close to him does not wear a mask, the infectivity or the transmission is reduced from 70% to 5%. If both of them wear a mask, the infected person and the person who's near him, the transmission can be as low as 1.5%. So just by the simple mechanism of masking, you bring down the transmission from 70% to 1.5%. The second important aspect of preventing the disease transmission is physical distancing. Earlier, it was believed that the predominant form of spread was droplet mediated, which means the virus will stick to the small droplets in the respiratory secretion. So when I have COVID, I talk, laugh, cough, sneeze, sing. Small droplets of respiratory secretions to which the virus attaches and sticks travel out, and these particles generally fall within 3 to 6 feet of the person from whom it arises. This is what is called droplet mechanism of transmission. And so if a person is more than 6 feet away, the chances that this person will pick up the infection from a patient is very, very unlikely. The second method of transmission is from fomites, is believed to be very negligible. But we are having increasing evidence to say that the airborne form of transmission, that is, even though it is attached to small respiratory droplets, the droplets are so small that they can transmit or fly in the air and stay in the air circulation for several hours, which means in closed rooms, unventilated rooms, the disease can spread from one person to another, even if the other person is more than 10 feet away. That is why we insist that everything has to be very well ventilated and in the open to minimize the chance of infection. So we realized all this in the past, and we have taken appropriate precautions till, as part of the normal human psychology, we started relaxing on these principles. The government came down on the enforcement. Theaters were opened, restaurants were opened, parties started happening, nightclubs started opening, bars, pubs. So situations where people congregated in close proximity in unventilated, closed conditions all increased the risk, whether it was a transport in the bus, air-conditioned cars, air-conditioned trains, all of this increased the chances of the disease spreading. Two, people became tired of this epidemic. People were fed up. They just wanted to go out and have a great life, party. So they stopped wearing masks. They stopped physical distancing. Schools and colleges started reopening. All this added to the fuel. And of course, the natural ability of the virus to change itself during multiplication, what is referred to as mutation, also added to this cocktail. So all of this have increased the chances of a second wave, which is now appearing to impact far harder than the first wave. Even though the number of cases recorded is higher this time, my personal opinion is that the number of cases were far more the first time we came around. But because of various reasons, testing was not as efficient as we do now. Whether it is the availability of the test, the cost of the test, the turnarounds of the time of the test, the fact that people are more open to testing right now than before, where there was a huge stigma attached to it. The fact that nobody realized, nobody bothered to test even after 5 days or 7 days of fever last time. And most of them ended up in the hospital very sick, and a lot of them died even before reaching the hospital, has changed. Now it is the educated class. Now people are affluent. People, the minute they get a sore throat, they get a test done, they want to immediately go to the hospital and get admitted. Last time, the government hospitals were swamped. Now it is predominantly the private side because people can afford treatment and they all want to get admitted just because they have been diagnosed to have COVID on day one. They get a CT scan done. They immediately say, I want admission because I've got diabetes and high blood pressure and I need to be in the hospital. I don't mind paying. They are insisting on single rooms right now, which is very difficult to provide during times of crisis. So these are the changes which we have witnessed during the second wave, which has made it more difficult, especially on the private side, to handle patients. They can afford treatment. They get steroids at home. They buy oxygen cylinders, oxygen concentrators at home, prepare, and then most of them continue treatment at home. There is abuse of medication. All of that is happening because of the information pandemic, what is called infodemic, where wrong information spreads all through. I told you people get a CT scan on day one of diagnosis, which doesn't make any difference other than give you the radiation. They start on steroids. They start on all kinds of medicines, which has been touted through friends and other well-wishers in the social media. You find prescriptions running pages, ivermectin, doxycycline, azithromycin, Fabiflu. So many of these drugs, most of which have no proven evidence in the treatment through medical literature. So these are the changes we are seeing now. The other fact is the worry about the variants. I told you that the virus has a normal ability to mutate or change its genetic structure during multiplication. And sometimes these natural changes which happen can give the virus a survival advantage. It can become more infectious. It can become more resistant to treatment. It can also evade the immune response of vaccines. So that is coming up now because when more and more virus start multiplying, greater the chances of these variants occurring. And these variants, some of them, the UK variant, the South African variant, the Brazil variant. Now we have the double mutant variant in Bombay and the triple mutant variant in Calcutta. All of this are creating fear. We already know some of them may have benefits in evading the vaccine response, but people are afraid that the vaccinations may not be protective, even though the only option we have now is vaccination. It has been shown by studies done on the flu virus that it takes at least 3 to 5 waves for the population to get herd immunity. I mean, we are just in the second wave. We have to go through another 2 waves. By that time, there may be more variants which may not be effective in giving us immunity to secondary infection. So these are the troubles we are facing. So what is the option? The best option we have is getting ourselves vaccinated. But even with vaccines, there is a lot of hesitancy, reluctance to take the vaccine for various reasons. There is a cognitive bias in behavioral economics, which is called as optimism bias. Optimism bias is when we start thinking that bad things can't happen to us. So always we say that when we get a fever, when we get a cold, the first thing we say is, oh no, I was sitting in the air conditioner for 2 days, for 6 hours attending a meeting. I had a cold drink after the meeting. I had an ice cream 2 days ago. That is the reason I have a sore throat and a fever. We don't think of COVID. We try to give various explanations to say that the problem we are having, whether it is fever, body pain, and cough, which are classical symptoms of flu. Even if we know that 2 people in our house have had that fever and recovered, and then we are third, we still would like to think that this is related to the ice cream or the cold drink and not the flu. This is the optimism bias. Related to the vaccine, there is something called the omission bias. What do you mean by the omission bias? By not doing anything, you are subjecting yourself to less risk. That is a perception. So by taking the vaccine, I may develop a side effect. So by not taking the vaccine, I may not develop the side effect and the chance of getting COVID is low, so I'm protected. So it is a feeling that in spite of such a calamity of wave 2, we still would be safe and we don't want to take vaccines. It's a very sad part of the human psychology, but that is unfolding right now. Very few people are coming forward. Even among the healthcare workers, the uptake is less than 50%, which is very sad because vaccines have been phenomenally effective in control. Even if the vaccine does not entirely cover and protect against the variants, it still does give us immune ability to fight. So we have to realize this, and we need to ensure that whenever the vaccine is available, everybody takes a vaccine, because that is the only way forward for protecting ourselves from the third or the fourth or the fifth wave. So I'm going to conclude with what I would say my feeling, the way this is going to fold. It appears that we are now peaking in Chennai and Tamil Nadu in the second wave. I expect this peak may be lasting another 2 to 3 weeks before it starts slowly coming down, and hopefully in the next 2 to 3 months we should come down on it. But I believe there will be a third wave towards the end of the year, which means entire 2021 is a washout. Only probably after early 2022, I believe, I hope I'm wrong, I believe that life will probably slowly stumble back to a little normalcy, because we may have more people vaccinated, we may have more herd immunity because of natural infection. But till then, I think we have to prepare for the worst and ensure that we stay safe. Especially the elders, make sure that they get vaccinated, make sure you wear a mask when you step out and you physically distance yourself. I'm going to stop here. I think that's about 15 minutes or so, and I'm going to open up for any questions.
Thank you so much, Doctor. That was really very short and sweet. Doctor, we have our former High Court Judge, Dr. Justice Vimala, before you, who would like to ask a few questions. Yes, madam.
Good evening, Doctor.
Yes, ma'am. Good evening.
Before I ask a few questions, I'm a fan of your speech in Kalyanam Malai. From then onwards, I have started listening to your speech, and you are an outstanding and extraordinary speaker. I will tell you the reasons. Number one, you gave a very positive message that iduvum kadandu pogum. That is number one. Number two, you have been telling it to the audience that you feel pity that you are not able to give solace at a time when they are in deathbed. You are not able to convince the close relatives. That spoke about the humanity inside the doctor, which carried away me the entire opinion about even the doctors' community as such. Doctor, many of them would be waiting, so I may not speak to you now about your speech. I will continue to speak at a later point of time. My doubt is this, Doctor. You said that the transmission is through air also now, because we keep ventilation. But several people are living in a very, very close circle. And supposing my neighbor is getting corona, if I'm keeping it ventilated, keeping the doors open, what will happen to me, Doctor? How to save such a situation?
As long as there is good air circulation, you need not worry. I'm talking about closed rooms where it is air conditioned, where even if it is a room which is say 20 by 20, still the air is locked up inside. To give you an example, in the hospital circumstances, we have something called air exchanges. In the operation theater, the air exchange machinery or the air handling unit works to ensure that every hour 15 air exchanges happen, which means 15 times the entire air inside the room is moved out and a new air from the outside is circulated. The same thing is true for aircrafts also. When you fly, aircrafts are one of the safest systems for ventilation. But when you are inside a closed car where the internal air conditioner airing is only circulated, you are inside a closed room where the AC is on, the windows are closed. These are the areas which are at increased risk of airborne transmission. At homes, as long as you leave the windows open and have a fan on, you can keep your air conditioning on just to cool the room. But if you have air circulation, which may impact the efficiency of the air conditioner, but still, if the air circulation is around, there is no worry. It can't come from the next door neighbor to you. Only in people living in the same room, same house with air condition and closed doors, the risk is high.
Doctor, in the Siddha medicines, oxygenation remedy சொல்றாங்க என்ன சொல்றாங்கன்னா தேங்காய் பால்ல கிராம்பு போட்டு நீங்க சாப்பிட்டீங்கன்னா oxygen level increase ஆகும்னு. It so happened அது உண்மையா நடந்ததா அது dramatically எனக்கு தெரியல. என்னோட வெரி க்ளோஸ் ரிலேட்டிவ் சஃபர்ட் ஃப்ரம் சேச்சுரேஷன் ஆக்சிஜன் டெஃபிஷியன்சி இருந்தது. நாங்க இதை சொன்னோம், அவங்க அதை சாப்பிட்டுட்டு ஒரு ஹாஃப் அன் ஹவர்ல வந்து கொஞ்சம் இன்க்ரீஸ் தெரியுதுன்னு சொன்னாங்க. தொடர்ந்து அவங்க அதை சாப்பிட்டு இருக்காங்க. தொடர்ந்து ஆக்சிஜனேஷன்ல இன்க்ரீஸ் லெவல் நல்லா இருக்கு டாக்டர். ஆர் வி சப்போஸ் டு டெல் திஸ் டு த பப்ளிக்? இஸ் இட் சேஃப் டு டெல்?
Ma'am, I think we should be very careful with what kind of messages we circulate, because these are what in medical parlance we call as anecdotes. அதாவது ஒருத்தருக்கு நம்ம பண்ணிட்டு அது பெட்டர் ஆச்சுன்னா அது உடனே எல்லாருக்கும் வேலை பண்ணுங்கிறது அப்படிங்கிற ஒரு கன்க்ளூஷனுக்கு வரக்கூடாது. நம்ம எல்லாரும் we mean, intentions are good, we mean well, ஆனா without some evidence of study, of trial, இந்த மாதிரி மெசேஜஸ் ஸ்ப்ரெட் பண்றது I think sometimes can be a little
dangerous also.
Dangerous, correct, that's the word. நம்ம எப்படி நம்ம ஒரு உதாரணம் சொல்லலாம். நான் வந்து எங்க வீட்டுக்கு எதிர்க்க ஒரு வேப்ப இதை நான் கட்டி வச்சிருந்தேன், மஞ்சள் போட்டு. அது போட்டதுல இருந்து எங்க வீட்டுல யாருக்கும் கொரோனா வரல. சோ எப்படி இதை இன்டர்பிரேட் பண்றது? நம்ம very difficult. So we need some scientific rationale. As a scientist, forget homeopathy, allopathy, Ayurveda, Siddha. Scientific நம்ம approach பண்ணி அதை காமிச்சோம்னா that's always better than assuming anecdotally that it will work.
எனக்கு ஒரு சமயம் எப்படி தோணுச்சு டாக்டர், it is not going to give any negative impact. அப்போ so it is not going to do, even if it is not going to do any good thing, it is not going to do bad thing definitely. So சஜஸ்ட் பண்ணலாமான்னு ஒரு மைண்ட்ல வந்துட்டே இருக்கு. எல்லாரும் இறந்து போறாங்கன்னு கேட்கும் போது ரொம்ப பரிதவிக்குது மனசு. இந்த நம்ம இன்ஃபர்மேஷனை வச்சுக்கிட்டு ஷேர் பண்ணாம தப்பு பண்றோமோன்னு கூட சமயம் தோணுது எனக்கு. அதனால கேட்டேன் டாக்டர் இந்த கேள்வி. Thank you, doctor. Thank you so much. Thank you.
Thank you so much. As you rightly said, doctor is one very pleasant person of infectious diseases. He's also got an infectious smile around in his face while treating his patients. Sundar Mohan sir. Yes, doctor.
Good evening, doctor. Thank you so much for that very short and sweet speech on the second wave. Doctor, you said about these vaccines are very effective. Just tell us, doctor, because many of us have these misconceptions about these vaccines. Just tell us what exactly these vaccines do to boost the immunity.
Right. Now, vaccines have been around for over 100 years now. It also actually, vaccines initially were introduced by Edward Jenner way back in 1776, when there was a disease called cowpox, which mainly affected the milkmaids or the people who were, getting milk from cows. And Jenner found that these milkmaids somehow were protected from smallpox. Smallpox was a very dangerous disease which led to a lot of deaths. So Jenner found out that why is it that milkmaids or people who dealt with milking cows somehow did not have serious smallpox. And he found out that there was a disease from cows which was very similar to smallpox called cowpox. And since these milkmaids developed cowpox through cows drinking, cowpox is a very mild disease. It caused only a few blisters like smallpox.
Okay.
And this somehow protected them. So what he did was he took the blister fluid from people with smallpox, powdered them and injected it to healthy people and saw whether these people were protected. And he realized that they were protected. And that is how the concept of vaccination, where you take a small part of the virus, you somehow break it down or kill the virus so that only the antigen, the protein part of the virus remains. And if it is injected, this will not cause a disease, but this will stimulate the antibody response in a person, so that the next time when the real virus comes in, the body is protected. That is the basis behind vaccination. So there are several ways in which this can be done. Either you can use a virus, you subject it to heat or chemicals and weaken it like Covaxin, or you can take a small piece of the virus antigen, what is called a subunit of the virus, and inject it directly, or you can use a different agent, like a different virus, into which we put a small part of the virus, which is to which you need to produce immunity, and inject it. So several mechanisms of giving a vaccine, which will induce the body to produce antibodies against the virus, which will help protect against a natural infection later. Now, at present in India, we have two vaccines. One is called Covaxin. The Covaxin, which is manufactured by Bharat Biotech, uses the normal SARS coronavirus and kill it with chemicals, and then this is injected. So this is a whole virus which is inactivated and then injected to produce immunity. The Covishield, produced by AstraZeneca through the Serum Institute in Pune, uses a different virus called the chimpanzee virus. The chimpanzee adenovirus is taken, into which they put a small part of the protein making machinery of the SARS coronavirus and inject it, so that inside it goes in, produces the small part of the spike antigen of the SARS coronavirus, against which the body produces antibodies. So you have various mechanisms to induce immunity. What is very clear is all the vaccine types available, the two in India, the two in USA, the Moderna and the Pfizer vaccines, which are called mRNA vaccines, the Russian Gemelia Sputnik vaccine, the Chinese Sinopharm or Covax vaccine, or the Novavax of Johnson & Johnson, all of them are very safe vaccines. The risk of Pfizer and Moderna vaccines is allergic reactions, which is 10 times more than the other vaccines in the past. The risk of Covaxin, so far we have not detected anything. The risk of Covishield is that if given especially in young women, this can cause a clotting tendency, which sometimes can lead to serious consequences. Apart from these occurrences, which happen 1 in a million, the vaccines are all safe. The vaccines give 100% protection against death. The vaccines give, for example, Pfizer vaccine and Moderna give about 95 and 94% protection against serious infection. The AstraZeneca can give anywhere from 72 to 88% protection against serious infection, and Covaxin about 80% against serious infection. So taking it as safe, these vaccines definitely protect against death and decrease the severity of the infection. And I think everybody should be vaccinated. Yes, if you ask me, is it guaranteed that it is 100% safe? No. I told you 1 in 250,000 to 1 in a million can get a serious side effect. But sometimes you have to look at the benefit of the society at large. You are not vaccinating yourself to protect yourself. You are vaccinating yourself to ensure that society's immune system is raised. So this happens in pediatric vaccines also. We always look at a study where, suppose you give measles vaccine, 1 in 100 million can develop a serious side effect and the kid can die. Whereas if you don't give measles vaccine, in a population of 100 million, at least 1 lakh children can die. So based on that, you say vaccines are better. The same argument is there for this also.
So there's another misconception. They say these vaccines are not meant for a lifetime use. They say it is valid for a particular period. Is that true, doctor?
We still don't know, but because the virus is mutating, we feel that this vaccine may not be effective more than 6 months to 1 year, and it may become like the flu vaccine where you may need to take it every year.
Once.
You still need to wait and see.
Okay. Thank you. Thank you so much, doctor. Thank you.
Mr. Herald, I think the question you had put in the chat box has been cleared by doctor. He wanted to know, will there be any impact, side effects later or point of time of recovery? And he wanted to know whether people are getting confused regarding Covaxin and Covishield. Mr. Herald, I think that would have answered the question.
Yeah, I think whatever vaccine is available, take the vaccine, whether it is Covaxin or Covishield. Covaxin, second dose after 4 weeks. Covishield, the government recommendation is second dose after 4 to 8 weeks. So the later you take the Covishield vaccine, up to 12 weeks, the better the immune response. But what vaccine you take as first dose should also be taken as a second dose. Avoid Covishield in young women. So once this vaccine drive from the 1st of May, we believe, will start covering anybody over the age of 18, younger women less than 30 should preferably be given non-Covishield vaccine. But other than that, anybody can take any vaccine which is available.
That's a real information, doctor. Thank you so much. Next, we have Divya.
Good evening, doctor.
Good evening.
My question is not related to the medical part of it or the physical part of it. My question is related to the collective panic behavior, the profound psychological distress, and the increasingly exposed anxiety that we are going through in every wave. The wave goes down, then we settle mentally, and then a wave picks up. It reaches the peak, and then we go into anxiety. So how to handle this, how to go through it, how to be mentally prepared, and since the battle is already begin, how to overcome it, doctor?
You want a practical answer or a scientific answer?
Both. Both.
The practical answer is delete your WhatsApp. You remove your WhatsApp from your phone, 80% of your anxiety will come down. Okay. Now the scientific answer is, unfortunately, we are in the middle of an infodemic or an information pandemic, an overdrive which circulates sometimes wrong or false information. They have done studies on this and found that if the information is wrong, it spreads more virally than correct information. And if it is information related to politics, it again spreads like a virus. So COVID is now covering both political and health issues and a lot of misinformation, as Justice Dr. Vimala was saying, that everybody wants to help. So the best way to spread an information is, this Nobel laureate has said that in China, this virus was created in the lab and this cannot be a normal virus. You put that, tomorrow your message will go viral. It's very easy. People are looking for some solace, and any information is without checking the authenticity. It is forwarded to about 20 groups covering about 2,000 people. So one person in a matter of 5 seconds is able to spread it to 2,000 people. So this has to stop. This can stop in two ways. One, the government should come out with more transparent information on vaccine benefits, risks, and also the side effects, the adverse events for following immunization. So they should be more transparent. They should convey better. For example, right now, sometimes there's a lot of confusion between what is coming in the newsprint and what actually the government declares. So the press, the social media also have to become more responsible. One simple incident I will tell you. It came in the television about a month ago, not month, 2 weeks ago, I think, that 37 doctors in Gangaram Hospital in Delhi had COVID and all of them were vaccinated. That was a message which came in TV. So what will that tell you? That 37 doctors were vaccinated and all of them got COVID. You know, this is, so why would you think, do you think you'll be happy to take a vaccine? You will immediately say, what does it do? Everybody, doctors in Delhi are coming with COVID, so why should I get vaccinated? If you look at the news, out of about 500 doctors who are vaccinated, 37 got COVID, out of which 90% had very mild infection. They just had a sore throat and a cough and they got tested. None of them were hospitalized. All of them did well. The vaccine does not prevent an infection. You can still get an infection with vaccination, but it makes infection so mild that it doesn't cause any serious impact to the body. So it depends on how the information is portrayed, and that is very important, that press acts responsibility and ensures that correct information is given. So this is probably the only way we can get rid of this pandemic of fear and anxiety.
Thank you, Doctor. Doctor, there's one question in the chat box. Will there be any impact side effects at a later point of time after recovery? Is there anything to be done in order to avoid such circumstances? Before we could go to the next person, I think it would be nice if you could answer this, Doctor.
No, I believe this is later point of recovery after an infection.
Yes, Doctor.
There are some people who have been referred to as long haulers, people who may have continued symptoms even after recovery. A lot of people go through it. This may be in the form of a dry mouth, disturbances in sleep, disturbances in appetite, anxiety and panic attacks, joint pains, cough, which may persist for several weeks or months, breathlessness on exertion, and psychological effects, including difficulty in concentration. So these symptoms can persist for several weeks or months. Over 70-80% recover very well, but 20-30% may have this, which may be quite troubling. And I think we need to take symptomatic treatment for this. Usually, apart from damage to the lungs, which may scar the lungs very badly if the infection is severe, there is no other permanent structural damage to the body.
Thank you, Doctor. Next, we have Rohit.
Yes, ma'am. Good morning, doctor.
Good morning.
So, in the question and the general question, doctor. So, இப்போ விவேக் சாரோட டெத் வந்துட்டு உங்க எல்லாருக்குமே தெரியும். ஸோ சென்னையில இருக்க மக்களும் சரி, ஊர்ல இருக்க மக்களும் சரி, எல்லாருமே எப்படி பண்றாங்கன்னா, ஒரு நடிகர் சொல்றதான் வந்து கேட்பாங்க. ஸோ அட் த சேம் டைம் வந்துட்டு அவர் வேக்சினேட் போட்ட ஒரு 2 நாள்லயே வந்துட்டு இறந்துட்டாரு அப்படின்ற ஒரு நியூஸ் பரவணும்னு எல்லா பெரியவங்களும் சரி, ஒரு அங்கிள் ஆன்டிஸ் எல்லாருமே என்ன பண்ணாங்கன்னா, ஐயோ வேக்சினேட் போட்டாங்க. அட் த சேம் டைம் நீங்க சொல்றீங்க, மக்களுக்கு எப்படி சொல்றீங்க, இஸ் இட் ட்ரூ ஆர்எல்ஸ் வந்துட்டு அது உண்மையா இல்ல பொய்யா, அதை பத்தி தெரிஞ்சா நல்லா இருக்கும் டாக்டர்.
நடுவில் கொஞ்சம் நான் 1-2 வார்த்தை விட்டு போயிடுது. பட் ஐ திங்க் பேசிக்கலி இந்த கொஸ்டின் யூர் ஆஸ்கிங் இஸ், இது ஒண்ணு வேக்சினுக்கும் இது ரிலேஷன் இருக்குமா, அதை எப்படி நம்ம தவிர்க்கிறது, அது எப்படி இந்த கரெக்ட் இன்ஃபர்மேஷன் கொடுக்கறது அப்படிங்கறத கேக்குறீங்கன்னு நினைக்கிறேன்.
ஆமா டாக்டர், எல்லாருமே வந்துட்டு என்ன பண்றாங்கன்னா, லைக் விவேக் சார் இறந்துட்டாரு, சோ அதே மாதிரிதான் நம்மளுக்கும் வேக்சினேட் போட்டா, அதனாலேயே வந்துட்டு நிறைய பேர் போட மாட்டாங்க. சோ அவங்களுக்காக நீங்க என்ன சொல்றீங்க?
அவங்களுக்காக சொல்றேன், பிரஸ் ரெஸ்பான்சிபிலிட்டி ஒழுங்கா எடுக்கணும். ஒரு 10 வருஷத்துக்கு முந்தி மீசல்ஸ் வேக்சினேஷன் நம்ம டிரைவ் ஆரம்பிச்ச போது ஸ்டாண்டர்டா நியூஸ் பேப்பர் டெய்லி எடுத்து பார்க்கும்போது, குழந்தை வேக்சின் கொடுத்தாங்க, 2 நாள் கழிச்சு குழந்தை இறந்துருது அப்படின்னு வரும். இது பொய் கிடையாது, இது நிஜமான உண்மை. இன்னைக்கு வேக்சின் எடுத்தாங்க, 2 நாள் கழிச்சு இறந்துட்டு குழந்தை. ஆனா இந்த வேக்சின்னாலதான் குழந்தை இறந்ததுங்கிறத வந்து நம்ம படிக்கும் போது ஆட்டோமேட்டிக்கா நம்ம பிரெயின் அதை கனெக்ட் பண்ணி அதை மண்டல உள்ள தள்ளிடும். அதாவது வேக்சின் போட்டாச்சு, 2 நாள் கழிச்சு அது போயிடுச்சு, அவ்வளவுதான். பட் நம்ம இன்கொயரி வச்சு பார்க்கும்போது வேக்சினுக்கும் அதுக்கும் சம்மந்தமே இல்லைன்னு நிறைய விதத்துல தெரிய வரும். ஒரு உதாரணத்துக்கு, அந்த குழந்தைக்கு ஏற்கனவே பேதி நடந்துட்டு ரொம்ப டீஹைட்ரேட்டா இருந்தது, நடுவில் அம்மா போய் வேக்சினை போட்டாங்க, அதுக்கப்புறம் ஹாஸ்பிட்டல்ல குழந்தைய அட்மிட் பண்ணல, டீஹைட்ரேஷனால 2 days கழிச்சு இறந்துட்டு. இது வந்து நாங்க ரெகுலரா பாக்குறோம். வேக்சின் கொடுக்கறதுனால டெத் இருக்கா இல்லையாங்கிறது எஸ்டாப்ளிஷ், இந்த காசாலிட்டி இதனாலதான் இது நடந்ததுன்னு எஸ்டாப்ளிஷ் பண்ணி நம்ம சயின்டிபிக்கா ப்ரூவ் பண்ணினாதான் இதை நம்ம சொல்ல முடியும். அதுக்கு நம்ம எல்லா கேஸ் ஆஃப் டெத்தையும் we need to investigate. பட் பிரஸ் இந்த மாதிரி போடும்போது ஆட்டோமேட்டிக்கா நீங்க சொல்ற மாதிரி எல்லாருக்கும் அது நடக்கும். விவேக் அவருக்கு வந்து 59 வயசு ஆயிருந்தது, மேல் செக்ஸ், ஸ்ட்ரெஸ்ல இருந்தாரு, ஹார்ட் அட்டாக் வரதுக்கு சான்சஸ் இருக்கு. இப்ப இதுவே ஒரு 25 வயசு மனிதன் ஹார்ட் அட்டாக்ல செத்து போச்சுன்னா அது வேற விஷயம். 60 வயசு உள்ளவர் ப்ராப்ளம் இருக்கிறவருக்கு ஹார்ட் அட்டாக்ல செத்து போட்டா அது வந்து ரொம்ப ஆச்சரியம் கிடையாது. ஆனா நம்ம வேக்சின் போட்டது இறந்துட்டாருன்னு போது கரெக்டா உடனே நம்ம ரெண்டுத்தையும் கோர்த்துடுறோம். அது வந்து தவிர்க்கணும், நார்மல் ஹியூமன் சைக்காலஜி. பட் பிரஸ் ரிப்போர்ட்டிங் கொஞ்சம் கேர்ஃபுல்லா பண்றது அவசியம்.
ஓகே சார், தேங்க்ஸ் a lot சார்.
Chat boxல கொஞ்சம் questions இருக்கு, நான் குயிக்கா அத முடிச்சிடுறேன்.
That is why doctor, even I have in between I'm just trying to put in that also doctor.
Now shall I read it? Might be easier for so
is there any improvement after vaporization is one of the question, doctor. I have
vaporization is basically steam inhalation. There is no scientific evidence to say that steam inhalation benefits. If it helps you, you can take it, but we don't insist on steam inhalation. How about frequent drinking of water? If dehydration is common in people with COVID, especially if they have high fevers, so அடிக்கடி தண்ணி குடிக்கிறது அவசியம். ஒரு நாளைக்கு அட்லீஸ்ட் 1.5-2 லிட்டர் குறைஞ்சது குடிச்சு 3-4 times ஃப்ரீயா யூரின் போற மாதிரி வச்சுக்கிறது அவசியம். மூணாவது, my relation is
asthma tablets, doctor. My relation
asthma tablets
using regularly asthma tablets. Can we vaccinate, and is there any problem for health?
No problem. No medicine is a contraindication unless you are taking certain blood thinning medicines. Aspirin, clopidogrel, adalla blood thinners nu solla mudiyadhu. They are antiplatelet agents. Warfarin, azithromycin and the mari heart mechanical valve vechirukravanga, they should be careful when taking the vaccine. Other than that, no underlying illness, no medication is any contraindication for the vaccine. Is there any specific checkup needed?
To do before taking vaccine?
Illa, onnum kadiyadu. As long as you are reasonably healthy, you can go for the vaccine.
Doctor, there's one more question. Doctor, any suggestion for taking second dose if the person is tested positive after the first dose?
Very often asked question. If they get the infection and recover from it, the second dose of the vaccination can be given after recovery, usually 1 to 2 weeks later. So for Covishield 1st of March எடுக்கிறோம், 1st of April Covishield எடுக்க வேண்டிய டயத்துல இன்ஃபெக்ஷன் வந்துருதுன்னா after the 15th of April you can take it, because Covishield I told you 4 to 8 weeks gap குள்ள எடுக்கலாம் second dose. Covaxin எடுத்ததுக்கு அப்புறம் வந்துருதுன்னா once you recover, upper limit between 4 to 6 weeks you can take it. So you don't need to postpone it. Wait for a week. After recovery, comfortable, take the vaccine.
Doctor, is it necessary to wear masks at home as government has advised people to do so? There was so much of hullabulla about it in today's WhatsApp and newspapers with respect to government making it compulsory for people to wear masks even at their residence.
I'm not going to comment on this.
Comment on it. Okay.
Because I think whatever intervention is done, there should be common sense in it. when you are driving alone in your car, air conditioned, sitting alone and driving, I don't think it makes any sense for you to wear a mask because you're not harming anybody.
Says otherwise, doctor.
I don't know. I'm not. This is a congregation of lawyers, so I should be very careful with what I say. But I believe in common sense, and sometimes that is questioned.
Doctor, there's one more. We are now getting questions from pregnant women regarding vaccination. Your views?
Now, these vaccines have not been tested in pregnant women, so they are not licensed to be given in pregnant or breastfeeding women. Having said that, we know well that the infection can be a little more serious in pregnant women. So, pregnant women vaccine kudukanuma. Yes, we know the vaccine is safe, even though it is not licensed. It is safe. So we do what is called an informed decision making. That is, you discuss with the person, the pregnant woman, to explain the risk of COVID in pregnancy is higher. The vaccination is not licensed, but it is safe in pregnancy based on whatever little knowledge we have. So if you are interested, we offer the vaccine. So based on that, the American Society of Obstetricians and Gynecology, the American Reproductive Society, all of them have recommended pregnant women be vaccinated, even though the vaccine is not licensed. But the final decision should be taken by the pregnant woman. And if she feels it is okay with information, she can take the vaccine.
Is it advisable to take vaccine? Those who have, must be it's fits, doctor. I think it's misspelled as fits.
Yeah, they can. Seizures are not a contraindication.
Seizures.
They can take.
Okay. Doctor, next we have Karthikeyan. Karthi?
Good evening, doctor.
Good evening.
Doctor, actually today I took my second dose of Covaxin.
Good.
Hello. Yeah, but now I feel some little bit infection in my throat, doctor. So can I take any antibiotic?
Usually vaccines can cause body pain, low-grade fever, pain in the arm where the vaccine was given, all for about 24 to 48 hours. For this, only paracetamol is needed. Throat irritation requires warm water and paracetamol, nothing more. If this persists beyond 2 to 3 days, then you need to see if there is something else happening. But antibiotics is not recommended. Most of these don't require antibiotics. The reason why we have such a lot of antibiotic resistance is because we consume too much of unnecessary antibiotics. So I wouldn't recommend antibiotics.
Thank you, doctor.
Yes, doctor. The last question is from the invitee himself, doctor. We've got Mr. J. Ravindran. Doctor, before that, Tyndall has come. He's got some questions.
Hello, can you hear me?
Hello. Yes. Go ahead.
இப்போ இந்த ஆஸ்மா பேஷண்ட்ஸ்லாம் இருக்காங்கல்ல, ஸோ அவங்க வந்து சர்வை பண்ணுறது கஷ்டமா? அவங்க வந்து இப்போ கோவிட் ஏதாவது அஃபெக்ட் ஆகுது, ஏன்னா ஆல்ரெடி வந்து அவங்களுக்கு ரெஸ்பிரேட்டரி ப்ராப்ளம்ஸ்லாம் இருக்குது. ஸோ அவங்க ரொம்ப பாதிக்குமா, இல்லை அவங்களுக்கு பாதிச்சுன்னா அவங்க வந்து சர்வை பண்ணுறது ரொம்ப கஷ்டமா?
சாரி, எனக்கு சரியா கேட்கல. கொஞ்சம் can anybody
Doctor, he's just asking, asthma patients, if they are affected by COVID, is their survival rate very low, or what kind of the survival rate is theirs if they are affected
asthma
by
survival? Any structural lung disease பாதிப்பு இருக்கிறவங்களுக்கு mortality can be higher. ஆஸ்மாக்கானால ப்ராப்ளம் ஒன்றும் இல்லை, அதனால ஒன்றும் பயப்பட வேண்டாம். நார்மல் மெடிசன்ஸை கண்டினியூ பண்ணணும், அவ்வளவுதான்.
Tyndall, is there anything else you want to ask?
இல்ல, அவ்வளவுதான். Thanks, doctor.
Okay, thank you. Doctor, next we have the last question. I think, is there anyone else who would like to ask doctor any other doubts? I think we have a chat box of Miss.
I can see a few questions. I'll just read them out and answer since we
Yes,
have
doctor.
a shortage of time. As the viruses continue to mutate, understand that some of the mutations may weaken the virus over a period of time. Will the weakened virus dominate the world, and will we be more safer? Of course, vaccination is the best along appropriate behavior, but will the weakened versions be the more dominant type? See, viruses will not. This is the normal process of biology and evolution, that whenever an infective agent comes in, whether the virus is a bacteria, their main idea is to multiply and spread. If they are very strong, they multiply and kill the body, then they can't spread because they can't go from that person to another. So they will reach a level where they have to cause damage At the same time, they cannot completely destroy the person. So yes, there is a possibility this will become a weaker virus, but still it will cause death. It's like the flu virus. That's how probably it will become. Is it advisable? Azithromycin is taken in the past 1 year. Should additional check be needed before taking the vaccine? If somebody is taking azithromycin, if your INR, which you monitor periodically, is less than 3, 2 to 3, there is no issues. If the INR is more than 3, you need to get your doctor's consent before you can take the vaccine. Should I worry about blood clot after taking the vaccine if somebody is suffering from DVT? No, this vaccine is not associated with an increased risk of blood clots. So past DVT, which means deep venous thrombosis, is not a problem. Should we take the CRP test before taking the COVID vaccine? No, there is a lot of social media message going around. I know this was started by a doctor that you need to check your CRP to see if there is inflammation in the body before taking the vaccine. There is no medical evidence for this at all. I don't recommend taking the CRP. Last question, acceptable sugar level for diabetics before taking the vaccine. There is keep your sugar under control, which means fasting should preferably, ideally be less than 140, postprandial, ideally less than 180, if at least less than 200. So this is not just for the vaccine, this is for improving your body and your immune response. So keep it at that, otherwise there is no specific level you need to worry about.
Doctor, we have got one, Mrs. A.V. Bharati. Madam, I've unmuted you. Bharati, madam? Madam, I've sent a request to unmute yourself.
Yes.
Yes, madam. Go ahead.
What are all the precautions to be taken, doctor, to be careful so that we can avoid this, doctor?
Precautions, ma'am. General precautions are what we call as 1, vaccination, 2, non-pharmacological. Non-pharmacological na mask, always wear a mask, physical distance, and hand hygiene. When you wear a mask, there is recent evidence that says as public, if they double mask, it will be even better. What do you mean by double mask? The doctors now put a simple surgical mask in the blue color or green color, triple layered mask. So you wear that and you keep it tight. You shouldn't be loose. There shouldn't be gap on the side. It should fit correctly. On top of that, you wear a cloth mask. So if you wear a surgical mask and a cloth mask on top, that gives you almost 85 to 90% protection. Much better than simple surgical mask also. So if public do that, I think that's the best way to keep yourself.
One more question, doctor. The oximeter we use, doctor, that oxygen level, what should be the rate, doctor? Each one is specifying one type. One says below 90, you have to approach the doctor. Above 94, it is safe. 93. What it is exactly, doctor?
The magic level is 94. 94 க்கு மேல இருந்ததுன்னா ப்ராப்ளமே இல்லை. 94 க்கு கீழே இருந்ததுன்னா ஹாஸ்பிட்டலுக்கு போனோம். பட் இதுவும் எப்படி மெஷர் பண்ணணும்னா ஆல்வேஸ் யூஸ் த டாமினன்ட் ஹேண்ட். ரைட் ஹேண்டட் இண்டிவிஜுவல்ஸ்க்கு ரைட் ஹேண்ட்ல எய்தர் இந்த மிடில் ஃபிங்கர் ஆர் இந்த இண்டெக்ஸ் ஃபிங்கர், இந்த 2 ஃபிங்கர்ல வைக்கிறது பெட்டர். வச்சு அட்லீஸ்ட் 1 minute to 1.5 minutes பார்க்கணும். நம்ம வச்ச உடனே சம்டைம்ஸ் the level will be 90. Within 10 seconds, tuck, it comes to 96. Not a problem. If the whole time it is 90, repeat it after 1 or 2 hours. Again it is 90 or 92, repeat it. Again it is 90 or 92. That's when you should reach, ask for help. Sometimes it starts at 92, சரண ஏறிடுதுனா ப்ராப்ளம் இல்லை. சம்டைம்ஸ் இப்போ வைக்கும்போது 92 இருக்கும், half an hour கழிச்சு வைக்கும்போது 98 இருக்கும், ப்ராப்ளம் இல்லை. ரிப்பீட்டடா பார்க்கும்போது அந்த ஃபுல் டைம் 1.5 2 minutes 94 விட கீழே இருந்ததுன்னா then you need to seek assistance.
Thank you.
Continuation with that, I think there was one more question at what is the exact time limit where we'll have to go and seek hospitalization, where we have to go get ourselves hospitalized? What is that stage, doctor? As you said, everyone who has been tested positive go and get themselves hospitalized, which causes great concern to others who really need medical care. So when is it that we have to go and get ourselves hospitalized?
If your oxygen saturation is persistently under 94, if you're feeling unwell, either persistent high-grade fever, you're not eating properly at all, you're having severe diarrhea for which you need IV fluids, then you seek hospitalization. Please remember that 80% of people who have COVID will recover without even seeing a doctor. All they need to take is crocin. 20% may require medical intervention, out of which 5% may become serious. So just because you have diabetes, just because you have hypertension, you don't need to panic. Most people do very well. So monitor your oxygen, control your fever with paracetamol, drink plenty of fluids, and stay positive. That is all you need.
And doctor, one more question. When the RT-PCR says it's negative, and then you do a CT, they say that they give you a limit of 3 out of 25. So how is it, doctor, whether that patient is COVID positive or COVID negative, or what it is? The RT-PCR says it's negative.
The CT scan is more sensitive than the RT-PCR. The CT scan will pick up 80-85% of cases. RT-PCR picks up only 60 to 70% of cases. So if the RT-PCR is negative and the CT shows strong features of COVID, it is probably COVID. That doesn't mean everybody who has an RT-PCR should go for a CT scan. If the PCR is negative and clinically you suspect COVID, then you go for a CT. Otherwise, routine CT is not necessary for anybody. And even if you are diagnosed positive, CT scan is not a must unless you are deteriorating and we need to assess how much of lung is involved. I see a number of patients who do RT-PCR are positive, immediately do a CT, repeat a CT after 3 days, repeat a CT after 60 days. This is all radiation which increase the risk of cancers. Please don't do that. The other thing which I commonly see is the RT-PCR பண்ணும்போது they have a CT or a cycle threshold value. That it has gone around saying that if the value is low, high viral load, if the value is high, the viral load is low. Please remember that is correct, but this has no correlation with the clinical symptoms. So just because I have a high viral load and a low CT value doesn't mean I have severe disease. Early stage, இன்னைக்கு ஜுரம் ஆரம்பிச்சு இன்னைக்கே டெஸ்ட் பண்ணினா CT will be 10, viral load will be high. இதே பேஷண்ட்டுக்கு 6 நாள் கழிச்சு பண்ணனா CT value will be 25, virus will be low. அதுக்கும் கிளினிக்கல் அவங்க மோசமாவாங்க நல்லா இருப்பாங்க ப்ராப்ளம் வரும், no connection at all. So don't get worried or fixated on the cycle threshold value.
Thank you, doctor. Doctor, this is Anjana Sasi.
If a person is suffering from fever, and after how many days we have to test?
If you are diagnosed to have COVID and it is a mild infection whereby you don't require hospitalization, we advise at least 10 days of isolation. This may extend up to 14 days. For most people, mild infection, 10 days isolation is enough. You don't need to repeat a COVID test because sometimes a COVID test may be positive because the dead virus is identified. The test may be positive for 4 to 6 to 8 weeks also. So repeat testing is not indicated. Once you get the infection, you quarantine for 10 to 14 days and then you get out and be normal. You don't need to repeat the test.
Doctor, the last question is from the invitee, Doctor, Mr. J. Ravindran.
2 questions, Doctor. One is that you said that there would be a peak in mid-May. How much people do you expect to be infected in Chennai and in Tamil Nadu, Doctor?
Unfortunately, I'm not a public health person. I'm a clinician. So in the mari prediction போட்டு எவ்வளவு பேர் வருவான்னு சொல்றது எனக்கு தெரியாது. But definitely one thing I can tell you, the number of people last time I think was much more, but now more people are testing. And that is the reason why the number of cases has phenomenally gone up. But the numbers, prediction wise, I can't say clear.
Okay, doctor. Secondly, doctor, you said that there would be a third wave during December. What should be the from the third wave? Because there are so many allegations saying that the government is not prepared, lack of oxygen. I'm not going into the merits, but there are various allegations. To overcome that, what should be the preparedness from the government at this stage, doctor, to overcome third wave?
See, I strongly believe it is not the government's responsibility alone. It is every citizen's responsibility to be safe and responsible. As my responsibility, I have to do 2 things. 1, ensure the non-pharmacological methods, masking, physical distancing, and hygiene. 2, pharmacological, have my vaccination whenever I am due to get it. If every citizen takes care of these 2 things, I think government need not do anything. We don't need lockdowns. We don't need restrictions. Everything will be safe. So I think it is every one of our responsibility and discipline to ensure that we stay protected.
Doctor, before we wind up, one small thing. We would like you to just address us as all of us need to be resistance fighters, and then the mental strength all of us should have to fight this. With that, we shall wind up, Doctor. A small, so that it gives a boost, it gives them the positive vibe, it gives them the confidence to fight it.
Absolutely. I believe, in fact, I tell only two things to all my patients who get admitted. I tell them that we will give the medicines, we will give the oxygen. So medical aspects, we will take care. But there are two things which I want you to do, which as a doctor, I can't do. One, you need to have a good diet. During times of COVID, especially, your appetite is poor, your mouth is dry, you're frustrated, you're scared, you're upset, you don't eat properly. This should not be the case. You need to eat well to improve your immune system. Two, unless your mind is strong and positive, we cannot beat the enemy. So which means medicines can't get this. If I am convinced that I will be strong, I will face the enemy and I will get rid of it, half the battle is won. So ensure that you stay positive, you stay upbeat, and that you'll beat the virus. Most people will get well.
Doctor, thank you
Thank
so
you.
much, Doctor, for
Thank you,
having
Doctor.
spent your
You have
valuable time.
valuable time, Doctor.
Thank you very much.
Thank you so
All the
much,
very best.
Doctor.
Thank you, Doctor.
Thank you, sir.
Thank you, Doctor.